I'm glad to sit here with Professor Chitnis from the Mass General in Boston. He's one of the leaders in pediatric MS, and you gave us today an interesting talk. But first I want to know what makes pediatric MS so special. What are the main differences in between the adult forms?
Well, children and teenagers are special in themselves, but the features that differentiate pediatric multiple sclerosis from adult MS are really three main factors. The first is it's highly inflammatory, so children have more frequent relapses, 2 to 3 times as many frequent relapses. The second factor is that there can be significant cognitive issues on a developing brain. If you have inflammation and multiple sclerosis, then that can lead to significant cognitive issues, and we do see that in our pediatric patients. Thirdly, and this is somewhat good news, is that children progress slower on the EDSS or locomotor walking disability scale, but the unfortunate news is that at a given age they will have more disability than a similar adult patient.
Okay, thank you. What, in your opinion, are the unmet needs in pediatric MS?
So there are many unmet needs in pediatric MS. We're just learning how to better earlier diagnose these patients. About 15 years ago, it was not well recognized that it occurred in children. Diagnostic criteria have certainly helped, but need to be further refined. In addition, children and their families who are now facing a chronic disease need a great deal of support in the clinical setting. So not only from the neurologist and a nurse, but also from a psychologist, family counselor, through the school, and through the community. In addition, we don't have approved treatments for multiple sclerosis. There are no treatments that are FDA approved in the US, and there's only limited interferon approval in the EMA, or through the EMA.
Okay. You are one of the lead investigators of Paradigm study. It's the first randomized placebo-controlled study in the field of pediatric MS, so far I know. Can you give us a short glimpse into the study?
Yeah, so Paradigms was the first phase 3 randomized double-blind, double-dummy study in pediatric patients with MS. It enrolled 215 patients from global sites around the world. This was quite a huge effort on the part of all the investigators, as well as the patients and their families. Patients were randomized to fingolimod or beta interferon 1A, which is given intramuscularly, and fingolimod, of course, is an oral drug, in a 1-to-1 ratio. So 215 patients were enrolled, and the majority completed the study. There was a higher withdrawal rate on the interferon arm compared to the fingolimod arm. And overall, the most exciting news is that the primary outcome measure, which is annualized relapse rate reduction, was 82%. So that is almost unheard of, really unheard of in a clinical trial in MS in general. And it's really a very impressive result in this pediatric population.
Okay.
And translating that into daily care, 85% of the pediatric MS patients on fingolimod were relapse-free over the 2-year follow-up period, compared to 38% of the interferon-treated patients, which is the current standard of care. So this does represent a very significant difference.
Okay. Thank you very much to share these interesting informations with us, and I hope we'll hear more from your field soon.